Registrar of Nursing Midwifery Council of Nigeria, and your team.
Thank you, sir.
Thank you very much for accepting to host us. Even when we had a lot of, we have had to make a lot of adjustments. At the shortest notice, you were able to accommodate us. And notwithstanding the behavior of activities you have today, you still had to take out time to host us. Thank you very much.
You're welcome, sir.
We are here because your council is one of the most important councils in Nigeria.
Thank you, sir.
And in our mandate as National University of Nigeria is to make education inclusive. And that inclusiveness involves every aspect of what we do in National University of Nigeria. We want to make sure that everybody is given opportunity. I'm sure you are aware that in the last convocation of our university, we had about 51 inmates who graduated from National University of Nigeria. It is in that spirit of inclusiveness that we have come to make a request. We have been running our BNSC program across all our study centers. But we've also noticed that the structure of our program in the nursing, in our BNSC, is such that it does not reflect that our mandate to make it very inclusive. A large section of Nigerians who want to be in your profession are not able to enroll with us because of the current structure we are running. We are not unmindful of what is involved in our request. What we are saying, sir, is to partner with you to make our mandate of making access to everybody who wants to have education in any discipline more effective. And that's why we have come to you this afternoon to ask that we work out a structure that will enable us to admit those who have O level into our nursing program. We are aware of a number of things that are involved. We are making this request believing that we will make necessary adjustments so that our people, our students who are admitted into the O-level program will have necessary attachments, the necessary medical facilities available for them to do both the practicum, and all other processes. We've taken that into consideration. In our team here, we have people who are nurses, who know what the intendments are. Professor Helen Kwanashin has been involved in training nurses for over 40 years, if I'm not mistaken. She's retired, and during the university, as a professor, you retire at 70. But if you see, she's still very strong, and she has been involved in training nurses in so many universities in this country, ABU, like I said, over 40 years she's been involved. You're also very familiar with somebody like Dr. Shegu Igbilade. We have a number of other people. But we just want us to agree on the possibility of making our nursing program more inclusive. We'll work out the details such that we'll be able to see that we do not run foul of any of your processes. We are ready to abide by that. Like he said, I am a professor of philosophy. I have here renowned people who can also add their voice. May I then ask Professor Helen Kwanashi to throw more light on this matter so that she will fill in the gaps that I might have left. Prof, thank you.
Nursing and Midwifery Council of Nigeria, this team. I'm very happy to be here. I'm a pharmacologist, and I I've been involved in the training of nurses at bachelor degree level in ABU, also in Amasoma during a sabbatical leave, and at the University of Freetown when I was a visiting professor there. All that before I came to NOUN. So I've been involved in training nurses at conventional universities, and for the last 5 years at an ODL institution. I have to say that you know my age already, so I've seen quite a bit of evolution of the nursing profession and the development of nurses over decades. From those of us who attended universities in the 1970s, we know that nursing has come a long way. The nurse is a respected healthcare professional because, unlike others like doctors, pharmacists, who spend 10 minutes or less with each patient, the nurse, most of whom at one time or the other were bedside nurses in hospital or clinical settings, usually spend up to 8 hours or thereabout, their entire shift with the patient. So they are the ones that are most conversant with the patient. The patient belongs to them. And that's why when other healthcare professionals enter the ward, for instance, they know that the ward belongs to the nurse. So everybody who understands these concepts, they respect nurses and the role they actively play, not only in instances of disease, but even in well-being, where there is no sickness, in maintaining health of individuals, of groups, and of communities as a whole. And this knowledge or this appreciation is even increasing as we develop further. For instance, last year at the University of Abuja, at a point during their admission process, the cutoff points for admission into nursing and medicine were the same, 240 in JAMB. That was never the case, even in the recent past. It just shows where we are going. And that cutoff point was higher than for pharmacy, for instance, and for vet medicine. I think the nursing profession should regard that as a recognition of how far they have come. Many of us know this drug, Viagra. We pharmacologists, we call it sildenafil. It was developed by Pfizer for heart conditions. It was a nurse, and the nurse who was alive to her nursing responsibilities of being observant, of recording, of reporting, and of discussing, that brought it to light that the drug is even better in erectile dysfunction than for heart condition. How did this happen? The drug was being tested. It was still under clinical trials. And an observant nurse found that the male patients were all lying, let me use a word we all on their stomach. They were all lying on their dorsal, side. Anyway, they were all lying on their bellies. And that was so because the men were having erections and were embarrassed that they were sick, they were on admission, and they were having erections. But an observant nurse who has been spending hours seeing all these patients took notes, and when the ward rounds came, was able to discuss it, that this is what she observed. Of course, to cut the long story short, the thing went back to studies. Pharmacologists usually play a very big role in substance. And eventually, Pfizer now made more money from sildenafil for the treatment of erectile dysfunction than for cardiovascular diseases. So many of these things that have come to light through nursing practice, through nurses who are alive to their responsibilities, is such that the respect for the profession has greatly increased in the last decade too, not only in Nigeria but everywhere in the world. I want to say that a few years ago, a doctor applied to our department at NOUN for admission into the nursing program. And we unfortunately couldn't admit him because he didn't meet our criteria, and the Nursing and Midwifery Council of Nigeria would not have accepted that, because for a nurse to be at NOUN as a student, they must have basic clinical skills acquired in the School of Nursing or in the College of Nursing, and they must also be in a clinical setting where they have maximum access to practice. Anyway, all that is story. But I just want to say that we are a responsible university. We've had long years of experience in nursing education. Whether we are full-time, whether we are trained nurses or we've been training nurses. So when our Vice Chancellor and our university makes a request that we would like to admit students straight from secondary school and train them to be generic nurses, we have done our homework extensively. And we are sure that we are capable of doing this to the satisfaction of not only the university system, but of the council, and to the betterment of the patients and the healthcare system in the country as a whole. We know this because we have checked worldwide. We found that this is taking place in some places in the university, in some places in the world. And we would be, as the premier ODL institution in Nigeria, we want to be and determined to be the foremost university in the entire country, and we would like to spearhead this initiative. We know what will be in place, we think we know, but we want to partner with the council, get all stakeholders involved, so that we can have the best situation, the best conditions, the best regulations that will not shortchange the quality of education that the nurses will receive, and the quality of the practice of nursing care, nursing responsibilities that they will discharge to their patients in the ward. I keep using ward because most nurses work there, but of course we know that nurses work elsewhere. Yes. So, sir, for example, I will leave the nitty-gritty for the rest of us, Dr. Ibilade, for example, and even myself, if it comes to me, so that we can share with you what our ideas are. But frankly, we are hoping that this process will be one of participatory methodology. That is, stakeholders will get involved, from the council, from the ministries, from the people who are in the wards themselves, from those of us who are in the classroom, and work out how these nurses, we call them generic nurses, can be trained straight from secondary school without losing the quality of service that they will render. With your permission, sir, I think I can pause here, just to pause. Thank you.
We are ready to abide by the standard. And one thing we want to assure you is that ODL, open and distance learning, has come to stay. It is now the way the world is going. And in other countries, the ODL institutions will function like every other. Give us the regulations, let us abide by them. Thank you, sir.
Thank you very much.
This is admin. Okay, sorry. He's in
thank you, sir. With the permission of my Vice Chancellor, briefly I will congratulate you, because this is the first time the university is engaging with you after assuming office. And though you are not new to Noun, and Noun is not new to you, yes, we appreciate. As my Vice Chancellor rightly said, the ODL system is a system that has come to stay. So we now want to put into practice a sort of a system, a blend system, if we can call it, that will allow us to start. I know when we come to the nitty-gritty, we'll discuss it. Because the Open University now is considering certain other courses, not in the entire 130 study centers, but in particular centers where those courses will be domiciled with all the necessary regulations and facilities and whatever it requires for those particular courses to succeed. So we, as he rightly said, are looking forward to doing this, particularly that we noticed conventional universities have also started doing distance learning. And they are doing this nursing in distance learning and other things and poaching, if I can say, into our own students. So that's what we come from, that's why we decided to sit down. And as he rightly said, we are going to abide by all the regulations to set up these locations with the permission of the council, and then to see how it goes with all the necessary requirements in place. Thank you so much, Mr. Vice Chancellor, for giving me the opportunity to say a word or two. And we still appreciate the council for its regulatory role that it has been played in National Open University. Thank you, sir.
Thank you, sir. The interest you have shown, the history you have given, they are all stimulating and motivating. But let us go back to history. You talked about the structural education of nursing and posed at a time that in the clinical setting, this is the situation. You further recognize the study that led to a research and then confirming the usage of a particular drug. We also noticed that data came to play based on observations. So now, how did nursing got into National Open University? Is the first question. The thought to do a placement course or a bridge course to give people opportunity of being graduates in a specific field of nursing was the initial thought. Prior to them, far back 1965, the degree in nursing, baccalaureate, started in Ibadan. And by 72, Ife also came in. But the rate at which people were graduating was so small and so low. The leaders of the profession then looked at it critically and envisaged that in due course, this certificate training will not have a bearing. It is better, it is formalized and restructured, and it will be good that those who have earned this certificate not be thrown away, but bring into the fore. And while the thought was going on, the establishment of National Open University came on board. The first set of students to be admitted into National Open University were those that took their admission forms in 2004. And with that, in Gombe 2005 Leaders Convention, it was agreed that every nurse in Nigeria should be a graduate nurse latest by the year 2015. That was the genesis of saying, okay, now that the conventional universities don't have an open space to accommodate the people willing to go into the program to earn their degrees, let us go through National Open University. Many health professionals, including the pharmacists, challenge that why are we taking nursing to the Open University? We told them it's a process of intervention. And that was how the whole program started. While the challenge was on, everybody questioning, it was clearly stated that it is not meant for generic program. It is meant for registered nurses to go in to get their degrees. And that was the beginning. 2004 application given, 2006 given, but the studies was not effective not until 2007. So it all started that way, and gradually I don't want to talk too much so that when we get to the committee level, possibly we'll talk about it. But there are some other things that happened that brought in question mark. Mr. Igbinlade may bear witness that during that time, the process was unscrupulous. From all angles, people were coming in. Everybody was just coming in. That also draws a question mark. Now, let us not talk about what some product exhibits that is making the whole nation to look at it again. However, the thought and the vision of the new VC, we will listen and we will expect the university to drop the concept note with explained structure design for us to study. Because what you are saying, very well, you know it very well, that nursing being science, art, and what? Psychomotor activity. I don't know the way you have x-rayed it. Since you say you have developed the structure, I'll wait for you to see it the way you may want to present it. But for now, we may not talk too much. We have welcomed you. We appreciate your thought. We appreciate your vision and the desire to make it a generic program. Let us see the concept note. We'll look at it. Sorry. However, before now, sir, I want to inform you that even before this your visit, even before the first announcement of the proposal to visit, we already have a plan to meet with all the universities running open distance learning program in nursing. We have identified issues with the process and we want to review it and restructure it effectively. Now, we are proposing 18th, am I right? 18th of this May to have meeting with all the universities running the open distance learning program in nursing. Probably before then, or whoever represents the university may be able to tell the committee again that we are setting up so that we can have a vivid look at the structure you are packaging. It will be open to all. Everybody will contribute and will review it. And then at that time, it will ease the process of the discussions we are making today. I'm not going to talk too much. Neither shall we look at things in deep sense, but I welcome you, I welcome the vision, I welcome the thought, and appreciate the willingness to do. But let us have the concept now. Let us study it. Take it to an open space for discussion, and then we'll return back to you. So submit, sir.
Thank you very much. Leave behind the trail. It's a keepsake from the National People's of Nigeria. You show that we came, and as we have come, we are sure that with your permission we will conquer.
I keep asking whether it's a prayer. Thank you very much, sir.
Thank you, sir.
I appreciate that.
Thank you, sir.